Well, good afternoon. Over the weekend, hundreds of restaurants and bars, gyms, theaters, and personal care services, hundreds of businesses in 24 regions across the province opened the doors again. This is good news. It's a clear sign that we're on the right track. It's a clear sign that we're making steady progress. Tens of thousands of people are getting back to work, but we can't stop. And we won't rest until all of Ontario gets to stage 3. We won't stop until every worker in Ontario gets back to work and back on their feet. And today, we have more good news for Ontario families, businesses, and communities. The following regions will be able to enter stage 3 on Friday, July 24th at 12:01 a.m. Durham, Haldimand-Norfolk, Halton, Hamilton, Lambton, Niagara, and York Region. As of Friday, thousands of more businesses will be able to open up. And we'll be there for them when they do, because we're all in this together. And for the other regions who are entered stage 2 later in the process, please be patient. We'll get there very shortly. We've been working with Mayor Tory and mayors in Peel and Windsor regions, along with their public health units, to assess the situation and find a way forward. We know as a province that we can't ease up. We can't give this virus an absolute inch, and part of the process is learning from other jurisdictions about what works and what doesn't work. And we're always prepared to take additional steps to strengthen public health measures based on the advice of our experts, because we have to stay vigilant and we have to stick together. My friends, it starts with simple actions. Visiting your local restaurant or small business, shopping local, buying Ontario made when you're out at the grocery store or hardware store. Because if we all take those simple actions, we can make a big, big difference. Billions of dollars in economic activity, more jobs, more opportunity, the chance to build a better life for you and your family. We all have a part to play in rebuilding this province together. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. Thanks to the considerable and ongoing efforts of all Ontarians to stop the spread of COVID-19, 7 more regions will enter stage 3 this Friday. This is in recognition of positive local trends in public health indicators and a decision that was made in consultation with our Chief Medical Officer of Health. Physical distancing, wearing face coverings, practicing good hand hygiene, and keeping our social circles safe, they will all remain critical as we continue to safely reopen Ontario, as will case and contact management. To that end, our government has made considerable progress in strengthening and standardizing case and contact management through the implementation of a new custom-built COVID-19 system. We are starting the long overdue work of replacing fax machines and repetitive data entry with a streamlined process using cloud-based software. On July 17th, the first cohort of health units began using this new custom-built case and contact management system, including Peel, Kingston, Frontenac, Lennox, Addington, Grey Bruce, and Halton. Weekly onboarding of additional health units is planned in the weeks ahead, with the final cohort scheduled for the end of August or early September, ahead of a potential second wave. By implementing this new system, we can enable local public health units to accelerate case and contact management to quickly identify new cases and more effectively contain the spread of COVID-19. Doing so builds on our government's ongoing efforts to protect the health and well-being of all Ontarians. And thank you, and now I will turn it over to Mr. Phillips.
Thank you, Minister Elliott. This coming Friday, as the Premier said, an additional 7 public health units will take that important step into stage 3. They will follow the 24 public health units that opened last week, based on our process laid out in our framework to reopen our province back in April. I know that people and business owners are eager to reopen. While most businesses and services can reopen in stage 3, important public health restrictions remain in place, and following the advice of our public health officials remains as vital as ever. We will continue to provide support as we safely reopen the province. Last week, Premier Ford spoke about the successful negotiation of the Safe Restart Agreement that will provide the people of Ontario $7 billion as our communities reopen. This support is important. Everybody is facing additional pressures as a result of COVID-19, and we look forward to providing more details in the days ahead. I was visiting businesses in my riding of Ajax over the weekend, and I have to say I was very impressed by how seriously these owners, like other business owners across Ontario, are taking the public health advice and how easy they made it for their customers to take precautions. They provided plenty of space to physically distance, offered PPE where appropriate, kept hand sanitizer by the door, and are taking all of the other appropriate precautions recommended by our public health professionals. These are challenging times, but we are all doing our part and making it easy for others to do the same. If employers have questions, I encourage them to visit ontario.ca/COVID to access over 170 workplace safety guidance documents and helpful videos that we've made available. They can also call 1-888-444-3659. Another observation that has given me confidence is everyone's willingness to follow the public health advice. We all know it's not just about keeping ourselves safe. By doing our part, our responsible actions will protect others in our community and get the economy open faster. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Good afternoon. Thank you very much. Premier and the Health Minister as well, aside from the fact that you want those 4 full weeks of data, which will be marked by this Wednesday, I'm curious, you've spoken a lot about the key things like lower cases, hospital capacity, et cetera. I mean, for Windsor-Essex, I think it's obvious that it's about mitigating the outbreaks of migrant farmers. What specific benchmarks are you looking for specifically about Toronto and Peel region?
I'll pass that over to the Minister.
Well, we do need that specific data, those 4 weeks. That's really important in order to make those public health decisions about whether it's safe to move into stage 3 or not. But as we do so, it's really, really important that as we're opening the economy, people still need to follow the public health rules, to keep the physical distancing, to wear face masks if they're not able to do that, frequent hand hygiene, and maintaining your close social circles. All of that's important, but we need to make sure that we follow all these guidelines. We're going to continue to watch how things go in other areas, in the areas that have already opened to stage 3, and then we'll have to make changes if necessary. But we're also working with, for example, Mayor Tory and Dr. Davila. I know that Dr. Davila, the Medical Officer of Health for Toronto, and Dr. David Williams, our Chief Medical Officer of Health, are in very frequent contact to develop a set of protocols that's going to keep the people of the City of Toronto safe and healthy.
And Minister, yeah, you might want to take this one as well, or the Premier. On the contact tracing app, one of the other parameters about moving on to another stage is the ability to do more contact tracing. I'm curious if, because we're still waiting for the app to come out, would you move on to stage 3 for the remaining reasons with or without the app, or will that be something that you would want in place beforehand, or will you move on without it if you have to?
So what I understand, the app possibly be coming out Friday. I hear that from the federal government, but I don't think that will have anything to do with moving forward for Peel and Windsor and Toronto. But I look forward to getting that app. We're proud that it was produced here in Ontario with the help of Shopify and our technical folks down here. But we look at the numbers, and as long as they're declining and they're going in the right direction, and we consult with the local chief medical officer, that's how it's going to move forward. And hopefully they're going to move forward sooner than later.
Next question.
Next question comes from Randy Rath from Stage TV. Please go ahead.
Hi, Randy.
Hi, Premier. I want to ask about the opening of bars. The federal official said that going to a bar last week or the week before is a high-risk activity, and the OMA came out saying that we're moving too fast on opening bars last week. Are we putting economic recovery ahead of public health when it comes to opening bars?
Well, our number one priority is always public health and making sure that the people of Ontario are safe, and that's the guidelines I go by from our health table and science. And just keep in mind, every chief medical officer, all 34 of them in the province under Section 22, they could put stricter restrictions on bars, and you know, something I wouldn't disagree with that. But that's strictly up to the local chief medical officer. If they want to do that, by all means, but I always believe you can't put health ahead of the economy ever, because without people's health, there is no economy. People won't be able to go back to work. They won't hop on the transit. So health is our number one priority, bar none.
Follow up?
Okay, and I'd like to return to daycare. Some of the operators are disputing you, claim that 95% of daycares are open, saying that they don't have the same capacity because of social distancing and restrictions placed on them. But the bigger question is, if kids go back to school part-time, when those kids aren't going to school, there's going to be an enormous demand for daycare spaces that simply can't exist, that don't exist. Like, you can't come up with thousands or tens of thousands of daycare spaces to meet the needs of those kids. Is that not an enormous problem if we go back to school on a part-time basis?
Well, that's why I've always said, Randy, I believe in having the kids back in school 5 days a week, especially elementary kids. High school kids can take care of themselves, but it really puts a real challenge on families if they aren't going back. And that's what I'm hearing from parents, hearing from school trustees, that parents especially want their kids in class 5 days a week and in the class on the same hours. So I talked to the minister over the weekend. Matter of fact, I talked to him on yesterday, and he's saying regarding daycare, we should be up to 100%. But we have to make sure we're ready for any scenario coming up till September. And God forbid, we ever get the second wave or flu season starts hitting us. We just want to be prepared, but we're really taking the advice off the district school boards as well, along with our health teams.
Next question.
Next question comes from Cynthia Milligan from City News. Please go ahead.
Hi, Cynthia.
Hi, Premier. Premier, I've noticed in looking at the data that the group that is increasing the most in numbers of COVID positive tests are under the age of 39. So, for example, today we had 52 in the 20 to 39 range, 23 in the 19 and under. Do we have a problem in reaching young people in the importance of this? And it's been suggested to me that they're not buying into one bubble, that they're kind of cheating on their bubbles and creating multiple bubbles.
Yeah. Well, before I handed the Minister of Health, I heard the same numbers. I was shocked. But just a message to our young people, you know, you have such a future ahead of yourselves, and you may feel you're invincible and you'll get through it. It's not just about yourself getting through it. Yes, you're healthy, you're young. It's about your parents and your other family members and your grandparents. That's what you have to think about when you go out and say you go to a party or something. That's who you got to think about. Everyone loves their parents and cares for their parents and their grandparents. Do the right thing. You know, don't go to these parties if they're there. You know, it's not worth it. You're healthy, you're young, you may get through it, but it's going to be a different story for your parents and your relatives and the loved ones that are part of your family. I'll pass it over to the Minister.
Well, we do know there's a certain amount of COVID fatigue among our young people right now, and I know that that's been after months of not seeing your friends and being able to do things with them and socializing, but please, as the Premier has indicated, please remember that as we're opening up the economy, it is more important than ever before to please follow the public health rules. Please do the physical distancing, please wear face masks, please do the frequent hand washing and so on, and please maintain one circle. social circle. It's vitally important. We've got to prevent the transmission of COVID-19. We don't want to see a large second wave. In fact, I'd prefer we not see a second wave at all, but we all have to do our part. So, so please continue to follow these rules.
Follow up.
Thank you. And Premier, my follow-up for you, I hope you can answer this one. It's on the same lines, but would you think that perhaps strategically it might be a good idea to expand social bubbles so that younger people who are fatigued might stay in those bubbles if the emphasis was on the importance of maintaining a stronger bubble?
Well, that's something that we would talk to the Chief Medical Officer of Health and about expanding the bubbles. I think eventually we'll get there, but it's really, Cynthia, and we have such bright young people in our province. Guys, just use common sense. That's what it comes down to, is practice your social distancing, wear a face covering when you're around large groups. And don't worry, we'll get back to having good times and everything, but we just can't go to these big parties at all. That's where the problems start.
Next question.
Next question comes from Lorenda Redekop from CBC News. Please go ahead.
Hi, Lorenda.
Hi there, Premier. We keep hearing from experts that opening bars and restaurants is putting those businesses before kids, with concerns that opening indoor dining is going to be resulting in a spike. What's your reaction, and what will your government do?
Well, I always said right from day one that everything's on the table. And if the medical team, the health team, says we shouldn't be opening the bars, or let's rephrase that. Maybe the physical bar, cut down half the people that typically go into a restaurant or a bar, make sure they stay seated. And I did receive that letter from Mayor Tory, and they're all great, valid points, and that's an option for the health team to come up with the right answer. But also, I just want to remind everyone, be it Toronto and Peel region, by all means, if you want to do that, you have the powers to do it. Matter of fact, every region in Ontario has the powers. It's such a large region. We can't compare Toronto and the GTA with, I always use Kenora because I love Kenora, but you can't compare it to Kenora or other smaller rural areas in the province. But again, everyone has the authority to make the changes, the chief medical officers, the local ones.
Follow up.
You mentioned the letter from Mayor Tory.
Yes.
He's calling for things like requiring restaurants to keep a log of patrons for the contact tracing. What is your government looking at when it comes to those suggestions?
Yeah, so the logs are already keeping them, what I understand here in Toronto, but I think it's the same practices no matter where we go in the province. And by the way, I'm so proud of the businesses, the places I've seen, no matter if it's small mom and pop shop or larger businesses or restaurants. Man, they're doing a great job, and everyone's pitching in. They're following the protocols from the chief medical officers, and I just want to thank them. Everyone's trying their hardest and doing their best. So again, I'd go back to making sure that you check with your chief medical officer, your local one, and follow the guidelines. We have 170 different guidelines over at the Ministry of Labor. So that's what I would do. And everyone's doing a really good job. But bars are an issue, we'll address that.
Next question.
Next question comes from Christina Tanalia from CP24. Please go ahead.
Hi, Christina.
Hi, Premier. Hope you're well. Actually, Lorenda addressed some of my questions.
Do you have a question for Rod? He's sitting there back there lonely, Christina. Look, he's just itching to get up here. Throw him an economic question.
Well, okay, actually, I have an economic question for you. When will you publicly announce the amounts that municipalities will receive from the federal government? I know you said last week that a decision would be made on the funding this week. So when will you announce it? When will we know more? And also, you were asked last week about how much, if anything, the province will be matching. There is the the guideline that there needs to be some amounts that are matched by the province. So how much will you match? You didn't say last week.
Yeah, well, this is a great question for the Minister of Finance. This is right over the plate for you, Rod.
Thank you, Premier, and thanks for the question. So it did take about 6 weeks to negotiate under the Premier's leadership and the other premiers these arrangements with the federal government, the $19 billion deal that was inked last week. So it is going to take us a few days to work our way through the exact nature of how that's going to be distributed. Of course, there's funds related to municipalities, transit, as well as other important areas. So in the days ahead, we'll have more information on that. We have had a great relationship working with our 444 municipal partners. They've been great advocates for this, and I think led by the Premier, our government has said we're going to make sure that we work with them to make sure that they have the tools. So that'll be in the days ahead, but there'll be more to follow later in the week.
Okay, thank you, Minister. The Premier, my follow-up is NDP leader Andrea Horwath is calling on your government to conduct an independent preparedness review of the government's response to COVID-19 and, of course, the readiness for a potential second wave. What do you think about that? Is that necessary? Is that something that is going to just cost the government a lot of money, and you're thinking here that this is something that you're already on top of every day? I mean, do you need an independent preparedness review?
I don't think we do right now. We're always under review on a daily basis. We've been very transparent. I'm up here on a daily basis answering the questions. We have commissions going on to find out what are the issues or confirm the issues. We know there's a lot of issues at LTC, long-term care, but so far so good. As long as we continue communicating with the people and the stakeholders and the medical professionals, and I think everyone's moving forward in the right direction. There's always room for improvement, and by no means are we close to finishing this battle. We're right in the midst of it right now. We can never let our guard down for a second, not even for a second. So as we move forward, we're all learning, and I got to give a shout out to the media again. You bring stuff to me, and it's great stuff, because you're the ears and eyes out there, along with the 14.5 million people. When my phone's ringing off the hook, they're the best ideas that come from folks like yourself, from people out there. And when I'm taking my tour, the only way you can really see firsthand what's going on is when I went down to Leamington and Kingsville and talked to the farmers and the mayors and just other regions. That's how you get the pulse of the people, by getting out there, not being stuck in this Queen's Park bubble that all you hear is other politicians. Talk to the real people out there. Listen to the real stories, the pain they're going through, businesses, the pain they're going through. That's how you get a real reality dose, by getting out there and talking to those folks.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. As part of the deal that you signed with Ottawa, the 10-day paid sick leave is part of that, is my understanding. Does that mean that Ontario is now abiding by that? Because you had expressed concerns about the 10-day paid sick leave.
Yeah,
before.
I just, myself and many premiers, I think there was one premier, John Horgan, that wanted it, and God bless him, he's a great premier, but the rest of the premiers, we just haven't been hearing about that. But the feds are going to, they're going to move forward with it, and I support it. At the end of the day, if that's what they want to do, that's great. I'm going to pass it over to the Minister of Finance.
Yes, so a part of that $19 billion does reflect, I think, just over $1 billion of support for that program. The federal government is going to administer that program, and we will look forward to finding out the details of how that needs to be approached. But obviously, they've been good partners, and we'll continue to work with them in the best way possible for the people of Ontario.
Follow-up.
And and on a slightly different subject, Premier, last week you said that we would know soon, perhaps this week, about who would lead the independent commission into long-term care. Just wondering, is that still on tap for this week? Are we going to see the person or persons who will lead this commission? And when will that commission report back its findings?
Well, definitely before the end of the month, and we're heading up to the end of the month. Robert, honestly, I can't give you an exact date, but I know I've mentioned to him we need to make sure we get this out by the end of the month and get moving on it. So I'm just as anxious as you, and I'm staying totally independent staying away from it. I'm letting the ministry look into it and make their choice. And I want to hear who's going to be on the panel, but I want a frank discussion. I want them to verify what we know already and confirm the issues that we've seen, all of us have seen. Nothing's been hidden, so we are going to fix this this challenge that we faced in long-term care.
Last question.
Last question comes from Travis Danrush from Global News. Please go ahead.
How you doing, Travis?
Hi there, Premier. Good, thank you. So we're hearing from a lot of Ontario truckers that are nervous about going to the U.S., crossing the border because of the numbers down there. What would you say to those truckers, and is there anything that the province can do to help protect them since they do have to cross the border?
Well, the Trucking Association, I know we're working with them very, very closely, and just making sure that we do everything we can to protect them from making sure they have enough PPEs. As over at Challenger last week in the Kitchener-Waterloo region, and they have a lot of protocols in place for their truckers to make sure they're safe and have a safe place to stay. And again, with the truckers, you just have to stay vigilant. I know you're driving for the most part by yourself, maybe with another trucker to rotate shifts, but you know, just be very careful. Drop off what you have to drop off. Try to keep your distance. Hop back in your truck and head back. The economy would stop if we didn't have these truckers. They're amazing. Travis, I had the opportunity to meet some of these truckers and thank them personally for the great job that they're doing, and just amazing that what they've been doing all throughout this pandemic.
Follow up.
And Premier, Scarborough and Etobicoke North, which is your riding, are two areas of Toronto that have been struggling with case numbers for weeks now. I asked you this before, but what additional provincial resources specifically in those two areas are being put into them to help reduce the spread? And do you think Toronto Public Health is doing enough in those two regions of Toronto?
I think all the public health folks are doing a lot, and I'm a big fan of Ms. DeVilla, or Dr. DeVilla, I should say, and she's doing an incredible job. But we put mobile units out in Scarborough. We announced it. People were showing up. Same with the Etobicoke North. We also have a drive-in testing unit just off Highway 27, just right almost before Humber College, and people have been going through there. So I encourage everyone to go and get tested. A lot of those two communities, and obviously I'm in love with Etobicoke North, but these families, no fault of their own. There's multiple families in a dwelling. Times are tough, you know, everyone's sticking together and supporting each other. So that's one of the big issues is congregate living, and we'll do whatever it takes to help these folks. It's been getting better, but we aren't there yet. So we'll keep monitoring it.
Thank you.
Thank you, everyone. Thank you.